Hello everyone, this is Patrick Matsinko. I'm here again at Lehigh Valley Health Network on Cedar Crest campus with Dr. Lewullis. Dr. Lewullis, thank you again for joining us. And for those that might have missed our first meeting that we had last month, just want to give people a little bit of a background, just sort of what you do here and just sort of what your background is, I guess.
Sure. I'm actually a Lehigh Valley native. Went to college at Princeton University. I was fortunate enough to play college basketball there. Played some minor league professional basketball in the area as well as overseas. I then went to medical school. I did a orthopedic surgery residency and then did a fellowship in sports medicine up in Boston, Massachusetts.
That's why you're such a Patriots fan, right?
That's correct, yes. Eagles fan. But I did my training and I was the assistant team doctor for the Boston Celtics in the NBA as well as Harvard University and Tufts University. So I then was able to come back home recently, and now here at Lehigh Valley Hospital, I'm the Director of Sports Medicine for Lehigh Valley Health Network.
And I know the topic that we'll kind of get into today for this episode is ACL, MCL injuries. Again, I know we talked before about concussions, something that are very, very prominent, but as are ACL, MCL injuries. Just to kind of think, I guess, thinking in broad terms, what is the difference between an ACL and an MCL injury, and how much does one impact an athlete versus the other, I guess?
Sure. So first, what is an ACL and an MCL? They're both ligaments of the knee. They're main stabilizers of the knee. An ACL stands for anterior cruciate ligament, and the MCL means medial collateral ligament. The MCL, I'll talk about a little bit first, is actually outside of the joint. If you have an isolated MCL injury, or the word sprain is often used for a ligament injury, a lot of those can actually be treated without surgery. The MCL can often kind of scar down and repair itself as long as it's not a complete tear or there's not another ligament injury with it, a multiple ligament knee injury, for example. That would be a different scenario. But a lot of times MCL tears, when I see them, they hurt really, really bad. Yeah. There's pain on the inside of the knee or the medial side of the knee. There's often an acute injury that brings this about. Patients feel very stiff, very painful. A lot of times though, we immobilize them briefly, then get them going with range of motion exercises, and often depending on the degree, we use the word type grade 1, grade 2, or grade 3. Grade 1 is a typically 2 to 3 week recovery. A grade 2 is about a month, 4 to 6 weeks recovery, and a grade 3 could be longer, and it may require surgery. That's the MCL.
How do athletes know, in terms of at the moment of injury or something, something along those lines? How does an athlete know when something might have occurred that isn't just that is maybe out of the norm, or something that could be a significant knee injury?
Sure. So one of the things that I'll ask my athletes or weekend warriors is, did you feel a pop at the time of injury? An MCL is often, it can be a contact injury versus non-contact injury, meaning someone hit you. An ACL injury, more often than not, is a non-contact injury. You hear people say, I was running and I tried to cut and my knee just gave out, or I went up for a rebound and I came down and my knee gave out. So the contact, is it non-contact, higher risk of ACL tear? The other thing that I like to ask, did they feel a pop or hear a snap? Within 24 hours, typically for an ACL, there's a lot of fluid in the knee. It's called an acute effusion. The word effusion means fluid in the knee or fluid in a joint. If there's a lot of fluid in your knee and it feels like there's water in there, that's another sign that something severely could have happened. If you are unable to put weight on it, I'd recommend going to the emergency room to get an X-ray, make sure that there's no fracture. A lot of times, fortunately, there's excellent athletic trainers in the high schools and the colleges around here that can evaluate a patient on the field or on the court if needed.
And I mean, how vital is that at the moment of injury? To kind of think about, maybe it's a basketball player, goes down, here's a pop, something happens, and they're the ones that kind of have to sort of spring into action, I guess. What kind of measures can they take in those moments that maybe can kind of help in terms of thinking about long-term prognosis, in terms of just what they're able to do at that moment of injury?
Sure.
I guess.
Well, there are catastrophic knee injuries that a complete knee dislocation, not a patellar dislocation or kneecap dislocation, which is much more common, but a complete knee dislocation or a fracture or like an open fracture where bones are sticking out, like those are things that the athletic trainers are trained to take care of immediately, and you have to triage them and get ambulance services there, EMT services there for something like that. More often than not, though, it's a traumatic injury, but it's not as urgent or emergent. Right in then and there after the injury, a lot of times you can get a good examination on the ligament to get a sense for how loose is the knee and what type of injury occurred. Over time, 24, 48 hours later, there's a lot of swelling, a lot of stiffness and tightness, and getting really great ligament examinations are somewhat difficult with the patient as their quadriceps fire and kind of block the examination. And that's where we start thinking about modalities like MRI imaging and things like that to help us with our diagnosis.
And then to think too about when surgery is required, whether it's a tear, ACL, MCL, when should athletes, kind of think about going that route, and when is surgery usually, when is it best after suffering an injury like that?
Sure. So, I tell my patients that are athletes that there's no great time for an injury and there's no great time for a surgery. And a lot of times when I have to tell a young boy or girl that their sports season's over, it's devastating to them and their families. And I definitely get that as an athlete, as an ex-athlete myself. But the timing of things really depends on the injury. Usually a full thickness ACL tear requires a surgery as long as it's a younger patient, no arthritis in the knee, and they still have an interest in sports-related activities. Often we wait around 3 to 4 weeks after the injury to do the surgery. And I don't like to use the word wait, but there's a lot of pre-rehabilitation that you have to do. When you tear a ligament, a lot of times there's so much fluid in the knee that there's so much inflammation that patients get a stiff joint. And one of the things sometimes we do is we actually drain the bloody effusion or fluid off the knee and get them moving again. And we also want to try to get their quadriceps working again, because the quadriceps, which is the main muscle of the thigh, can shut down after an injury. It's called quadriceps inhibition, and we want to get that firing again before the surgery, so they're ready to rock and roll after their surgery to get going with therapy.
And then thinking, I guess, about after surgery and after an injury like that, have you seen what is a typical recovery? But I mean, in the last couple of years, you see it a lot in professional sports and college athletics, and where it seems like athletes are coming back quicker maybe than they used to be, or is it not as devastating of an injury that maybe an ACL injury, is it maybe not as devastating as it once was?
Sure.
I guess.
Well, I think the injury itself is the same injury, but the way that we're thinking about it and treating it is differently. I think the surgical techniques that we do now versus 20, 30 years ago have improved, and that hopefully will lead to a better return to play. About 85% or so of patients with an ACL tear with an ACL reconstruction surgery can get back to playing the same level that they did before. It's hard though. For young people that have a torn ligament, it's really hard for them to get back. And I tell them a lot of times this is the hardest thing you'll do physically in your life to this point, in terms of emotionally, mentally, and then also physically. And it's hard, but getting back, a typical ACL tear with no other concomitant injuries is around an 8-month process from the surgery to getting back on the sports field. And even then, sometimes it takes a year or so even after that to really start feeling good about your knee again. But that's a typical time frame that I tell most of my patients.
And I'm sure it's just confidence as well, whether it's, on a football field and to feel confident to be able to cut again, or if it's, if it's basketball, going up for a rebound and kind of maybe being sure that when you come down and land, you don't have to worry about anybody being under your feet. And I'm sure it's just that having that reassurance that your legs are under you and that your knee is, back to what it was before the injury.
Yeah, and that's why I think the physical therapists as well as the sports performance staff that we have are so important in getting these people back, because you have to get a really strong leg to help stabilize that knee. And there's times that you have to look at how they're landing, or their kinematics, or the way they land. Is it incorrect? And there's we know now that there are exercises to help prevent that from occurring. And those are things that the athletic trainers and the physical therapists and the sports performance people will work with the athletes on after surgery and before surgery.
Anything else as far as ACL, MCL injuries, prevention, anything else that you would want to add there as far as just athletes and, like you said, parents and coaches as well, that just so that they're knowledgeable and aware, in dealing with situations like that, I guess.
I think you mentioned about, return to play and how early can you get back there. I don't think the focus should be on how fast can you get the athlete back, but you have to get the athlete back in the right situation. And there was a paradigm when everyone used to say 12 months for recovery from an ACL, and then it got down to 6 months.
Yeah.
And 6 months is not a realistic expectation for most high school or college kids. I think 8 months is appropriate, and if you're shopping around to find the doctor that will tell you I can get you back in 6 months, biology is biology. Rehabilitation is important, but again, you have to make sure that knee is nice and strong before you get back, and there's always a risk of re-tearing no matter how long you wait. So it's another thing that you have to balance as well.
Yeah, no, thank you very, very much for your insight on that. I appreciate it. And if people have any other questions as far as ACL, MCL, and just general injury prevention, things of that nature, where should they go for more information, Dr. Lewullis?
If you have any questions or looking for more information on sports medicine at Lehigh Valley Hospital, you can call our number at 888-402-LVHN or go on our website, lvhn.org/sportsmedicine.
Thank you again for your time, Dr. Lewullis. I appreciate it.
Thank you, Patrick.